Let's talk about lesions. The nice thing about using the brachial plexus drawing is you can literally put an X anywhere on the drawing and you can guess what the lesion would be. If I put an X anywhere on the brachial plexus drawing, I can deduce what a lesion would look like clinically. So for instance, if I put an X on the musculocutaneous nerve, since that nerve innervates the anterior compartment of the upper arm, then a lesion there would cause a deficit in the functions of the muscles of that compartment. The muscles of the anterior upper arm flex the elbow and flex the shoulder. So a lesion there would cause a weakness in either one of those or both those actions. So you can play that game by putting an X anywhere on the brachial plexus and deduce what deficits you would have. For now, let's talk about some of the common hand claws that result from damage to the median nerve or the ulnar nerve. A common lesion of the median nerve occurs in the carpal tunnel, in carpal tunnel syndrome, where the nerve is compressed as a result of swelling of the tendons. When the median nerve travels through the carpal tunnel, it innervates the thenar eminence and the lateral two lumbricals. If the median nerve is compressed here, then I would expect weakness of the muscles of the thenar eminence and the lateral two lumbricals. If I ask the person to make a fist, I would get a sign that looks like this. This is called the Pope's sign. Notice that the lateral two fingers have weakness in flexing at the metacarpal phalangeal joint, or the MCP joint, and the thumb has difficulty flexing, but the distal thumb is unaffected because of the flexor pollicis longus is intact. So here's my weakness in the thenar eminence and the lateral two lumbricals. Notice that I'm still able to flex the proximal interphalangeal joint, or the PIP, and the distal interphalangeal joint, or the DIP, because the muscles that attach here are in the forearm and not in the hand. The ulnar nerve innervates all of the intrinsic muscles of the hand except those that were innervated by the median nerve. Remember, the median nerve innervates the thenar eminence and the lateral two lumbricals. The muscles of the thenar eminence include the opponens pollicis, the abductor pollicis brevis, and the flexor pollicis brevis. So together, the muscles of the thenar eminence and the lateral two lumbricals form what's called the loaf muscles. L for lateral two lumbricals, O for opponens pollicis, A for abductor pollicis brevis, and F for flexor pollicis brevis. The ulnar nerve innervates all of the other intrinsic muscles of the hand. A lesion of the ulnar nerve would cause a deficit in the ability to use the intrinsic muscles of the hand, except for the thenar eminence and the lateral two lumbricals. So if you ask a patient to form a fist, they form what's called a total bear claw or Klumpke's sign. Notice that the fingers can flex, and that's because those muscles are in the forearm, but the interossei muscles, which are the major flexors of the metacarpal phalangeal joint, or the MCP joint, are weak. Notice that in the total bear claw there is hyperextension of the MCP on the other side. The reason for that is because the extensor digitorum muscles are unaffected because they're innervated by the radial nerve, and those muscles are also located in the forearm. The thenar eminence is fine, but the radial nerve and the extensor muscles of the hand are so strong that the thenar eminence is not able to flex as well, but it can still move. A lesion of the radial nerve affects the posterior compartment of the upper arm and the posterior compartment of the forearm. At the wrist, the radial nerve is responsible for extension of the wrist and extension of the fingers. So a lesion of the radial nerve would cause weakness in those muscles, causing overflexion of the wrist and the fingers. When someone's standing up, the person stands up with their hand behind their back, and that's called a waiter's tip sign.